Well, welcome everyone, and thank you for joining us today for this incredibly timely discussion. It's good to see everybody logging on here. First, let me say that I hope all of you are staying safe and using best practices to prevent the spread of COVID and the flu, and of course, taking care of yourselves physically, emotionally, spiritually, really looking out for yourselves as a whole person. We really need to do that more than ever nowadays. When we scheduled this talk, and we invited Dr. Brown to have this talk back in October as a follow-up to his first presentation regarding COVID-19 testing, which we held back in June, we had no idea that we'd be in the middle of this kind of resurgence or this significant rise in COVID positive cases in our area. So the timing for this information is just impeccable, really right when we need it. So today, the topic in our Let's Talk About series is let's talk about COVID-19 versus the flu. Dr. Brown's gonna talk with us about telling the difference between the two, speak about vaccines, best practices, how to prevent the spread in communities, which is extremely important to the people on this call and everybody globally. Just the options around the vaccines. So we have Dr. Brown with us as an expert family physician. He's with us today, and his training in virology and immunology and as a family physician, especially over the last 9 to 10 months, is our good fortune. We're really blessed to have him here as a resource and a wealth of knowledge for us today. As an introduction, a quick introduction, Dr. Brown is a Washington, D.C. native. He's the principal and founder of Doctors to You, a concierge physician practice servicing D.C., Maryland, and Virginia, and concentrating on the personal touch, focusing on the relationship between doctor and patient. I saw on his website the phrase more than medicine and treating the whole person, and Dr. Brown lives that every day. So he's also one of the leading COVID-19 experts in our area that we can draw on. He's been really at the forefront of this since February, March of this year. So lastly, please feel free to enter questions as they come up into the chat. Our very own Brianna, who is our facilitator here, will field those, collate those, and make sure that Dr. Brown gets those questions towards the end. And we'll have a Q&A at the end of the presentation. So Capital City Nurses is happy to present to you Dr. Ernest Brown.
Hi, everybody. It's a pleasure to be able to partner with Capital Caring and obviously with all friends and colleagues and family out there. I do wish everybody is doing well. I know we are going to be facing some challenges over the next coming months, and certainly there have been some heightened concerns just recently with some of these recent outbreaks. But I do want to reassure that we are all in this together still, and that we will continue to support each other through it. If at any point in time anybody who's on this presentation needs help, reach out. Don't feel afraid. This is the finest test of humanity, that we're here to support each other. So I would encourage that. My presentation, if you will, is more of a dialogue, and it is specifically for where we've transitioned now into the coming flu season. And with that, there are a few things that I'd like to review, but then I do want to open up to questions, dialogue, discussions, any particular cases that anybody wants to review too, even now or even thereafter. So let's get started. The flu, as everybody knows, has been around with us for quite some time. And we have had certain approaches through it historically. As a clinician, we have preventative practices, which is very much what we have for COVID-19. Obviously, for COVID-19, we have heightened those practices, but honestly, every flu season, abiding by the same practices had the potential to reduce the spread and impact of the flu each year. I do want to note that flu doesn't just happen one time a year. The flu comes in waves. There are certainly periods in time early in a changing season where there may be one variant of the flu. And then as the months progress, the winter months, there can be a close cousin that comes. And we are constantly monitoring these. CDC is constantly sequencing the different types of outbreaks for flu itself, as we will be doing for COVID-19. And that's a very important point, that everything that's being done for COVID-19 falls greatly in line with what has been done for the flu in the past. It's about what measures people take collectively as a country to be able to support getting ahead of this curve. The flu itself is a type of virus that it's difficult to, it's a reason why the flu, every year they talk about getting the flu vaccine versus other vaccines that we get, which, sometimes we only get one shot, or we get series of 3 shots. It is the nature of the virus that makes it unique, such that it is constantly changing. And that is very true for what we believe will happen with COVID-19. The differences that exist between the flu and COVID-19 are slight. One very strong difference with infection with influenza is we don't find the symptoms of loss of smell or loss of taste. Those are unique to COVID-19, and we really don't see those with influenza. Influenza itself, some people will say they have a stomach bug, or they have a respiratory infection or a sinus infection. But COVID-19, just by the biology of the virus, there are subtleties, but it does resemble a common cold. And that in and of itself is a conundrum, because the question is, how do you know? And the only way you can know is actually if you test. Now, COVID-19 specifically, we test for, but there are other coronaviruses that mimic the common cold and can actually make people very sick. In fact, before COVID-19, there was another COVID or coronavirus, NL63, that was in the area that actually was landing a bunch of my patients in the hospital, but it didn't fit the same pattern that COVID-19 did, which is why we didn't hear as much of a response. Flu itself, as a viral infection, has the classic symptoms that present. Now, when you get the virus, just like for COVID-19, it takes time for the virus to be in your system to be able to replicate and to cause the symptoms that you experience. Can there be people who are asymptomatic to the flu? Yes, just like there is for COVID-19. But if somebody is symptomatic for the flu, then they are highly contagious. The same thing is true for COVID-19. What we have seen, and obviously data will prove this further, is that it is more likely that you will shed virus in a way that will spread to others when you are symptomatic. And think about it, it's like you have symptoms, you cough, well, you spread by coughing. You sneeze, you spread by sneezing. All of these make it much more likely for contamination to occur. Symptoms can be wide. Somebody will say, well, I just have a little stuffy nose. Some people will say, well, I have a little scratchy throat. But guess what? We've just turned on the heat. There are the common fall allergies people have. I think we have to approach this as the individual, as opposed to just making generalizations. Like, how do you feel? And do you feel under the weather? Okay, could be the flu, could be COVID-19, could be a host of other viruses, but you have to take care of yourself. And in that regard, I do want to break away that it still applies. To prevent influenza means to do a variety of things that we know will also work for COVID-19. One is how well you take care of yourself. I can't stress it enough. It is a matter of, as long as this pandemic has been going, the effects it has had on people economically, but also physically and mentally, it is profound. And we will hear, there will be a legacy of this, I think. With the prevention, you have to talk about what is your strategy for regular exercise, good nutrition, good sleep, but other preventative measures, such as taking supplements like vitamin D, which has been shown to be very effective. Also, not just for COVID-19, but for your immune system and neurological system as a whole. Vitamin C is a supplement, 1 gram, which also fits the same pattern. And zinc, which many people will not get in a multivitamin, so you do have to supplement with that. But you can't do one thing and not do the others, and part of the others is for influenza itself. It is the vaccination. The flu vaccine is currently available. There are variants in the vaccine in terms of the manufacturer and its intended purpose. There is pediatric, adult, and there is high dose. The issue is looking at what medical history may dictate which variant of the flu vaccine would be best. If somebody has high risk, elderly, or immunocompromised, they are going to use the vaccine that's going to have a stronger punch. And that would be the high dose. Then there'll be others who are otherwise well, but are using the vaccine as a preventative to kind of boost their immune system if they acquire the virus. Now, the flu vaccine, it doesn't mean you take off your mask and don't wash your hands. It means you can still get the virus, certainly, but the idea is that your immune system is prepped. And that will be the same for the vaccine that's being prepared for COVID-19. It will not prevent you from getting the virus, but it may help your immune system deal with it. And obviously there will be more we can talk about in terms of the COVID-19 vaccine that is pending. And we can bring that up actually in the questions section. This issue of will the vaccine be effective this season is always, when we look at the vaccines and years, over the years, there have been certainly times when the vaccine worked very well and other seasons where it didn't. The vaccine is prepared looking at different sections of sequence of the influenza virus and making a prediction. We can't jump to the future and know exactly which virus somebody's going to get, so we can't make something that's going to cover exactly it. So we make approximations. And it would mean that if you are getting the flu vaccine, that approximation for what is expected should be effective. Now, very often people will not get the flu vaccine because they said, well, last year I got very sick after I had the flu vaccine. Well, the flu vaccine is designed to get your body to respond. So you should feel achy. You should feel a low-grade fever. You should feel, that is your immune system kicking on. And what it's doing is it's actually making antibodies, which are the first line to protect you against influenza if you get the virus in the future. Again, the vaccine will not prevent you from getting the virus. You will get it, but you'll be better prepared for it. All right? So with where we are now, we have a surge in COVID-19. I think this will be the year where we really take a look at the full impact of preventative measures as they are being used for COVID-19, how they spill over to influenza. I think where we are with influenza, if we were to make a comparison to the last decade versus where we are right now, where people are adhering, it will be very interesting to see what the numbers for influenza itself will be. I mean, could we talk about a tenfold reduction in hospitalizations with influenza and fatalities simply because we are also doing the same for COVID-19? So But we are, with a surge in COVID-19, talking about communities possibly shutting down, that there may be some decisions based on the numbers in the departments of health, determining is it a situation where we need to quote unquote lockdown. I don't like that phrase, but I think it means we are still going to have several months where I think this winter will be difficult. Difficult in the sense of where these numbers will be for COVID-19, but also because it's the winter. And I think we've already been in a situation where people have been confined, quarantined, isolated, and that I would say is very concerning, just for the mental health of everybody out there. I can tell you even for myself how infrequently I see my son, because I have to ensure that I am not infecting my own family, but I'm also not infecting my patients. Look, I get tested for COVID-19 almost every day because I can't be the typhoid Mary running around and giving the virus. So I can tell you, I am tired, I am fatigued. I am trained for this, but it's certainly taking a toll. But I would hope, I have very good colleagues, and everyone out there in the community has been very supportive. So I think we will get to a certain point, and we can all hope that things will gradually improve. And we have this lingering issue of vaccinating that is being prepared now, Pfizer and also Moderna. There are individuals who are already getting the vaccine in the Middle East from China, who would have, it's going to be a vaccine that actually is going to require one dose and then a second booster. And we're hoping that that will be available for compassionate use, I would hope, in December. And then if there is, and again, compassionate use would be for those who would be at high risk, just like the high dose influenza vaccine is for high risk individuals, this will be the same. And then a question of when it will be more widely available based. But I think there are efforts. If you were to ask me, will I be the first one getting the vaccine for COVID-19? And I will have to say, no, I will not. I will be waiting to see more data to come in to determine if I will actually receive that, because I'm testing myself. And I think prevention is the practices that you take as opposed to relying on a vaccine when there are preventative measures where you don't, if you do them appropriately, vaccination is less necessary. But that is where I'm at with that, and I can certainly have longer discussions about that. I do want to briefly mention that the flu vaccine itself should be readily available. It should be available at any local pharmacy. There are options where I think in certain practices they can give vaccinations in small communities. There are even vaccine drives that are occurring. I don't know how that will relate to COVID-19 when the vaccine becomes available, because it probably will be tightly controlled at first, and then will gradually be phased. But I do want to open up to see if there are any questions initially, because I know I can keep going on and on.
Great. Thank you so much, Dr. Brown. That was really, really insightful. So we do have a few questions for you. And for anybody who's joining us, if you want to type a question into the chat bar, we will be sure to get to it. So here's our first question. Of the numbers that the news is showing only COVID numbers, do you know if the CDC is tracking flu numbers, and have we seen a surge?
Influenza is always, and there are other viruses. In fact, they are looking at doing panels of coronavirus, not just COVID-19, but all coronaviruses. They are adding this, but this is really being done when patients are in the hospital. They are still tracking influenza because there is active testing for it, and it is reportable. So CDC is very much for the rapid and regular influenza A/B testing. They are looking at those numbers. In terms of where CDC is in reporting for that, We don't have influenza is just now starting to come into the area. So usually they're going to provide a report after they've seen a steady rise. In other words, if it's just a small smoldering fire, there really isn't much. They're more concerned with reporting any rise as it would be for COVID-19, which would then be more concerning. The fact that it is kind of hasn't hit a peak yet, I think it's a little too early, but I would be very curious to know in December where we are with influenza and its comparison to previous years, because I think that's going to be probably the most striking feature is our influenza numbers this year versus other years where we didn't have this level of precaution.
That's a good point. So at this point in time, how highly do you recommend getting the flu vaccine?
I highly recommend it because, first of all, we've had a lot more historical information on the vaccine itself. Anytime there's a new development for a different viral species, it does require additional research to look at side effects or other contraindications for it. But the mere fact that we've been doing the influenza vaccine for so long, it certainly gives reason for getting it. Certainly this year, it's a matter of exclusion too, to exclude influenza versus COVID-19. And who's to say that you don't get influenza and get COVID-19? You can have co-infection. You can imagine getting a co-infection with influenza and COVID-19, when you have a vaccine available already for influenza, it makes no sense not to get it, because co-infection does occur and outcomes are very, very poor.
Got it. With respect to, you mentioned too, because we have seen an unquestionable amount of difference in data this year because of the COVID lockdown. What is your opinion on lockdowns with COVID and the flu? If people are being COVID tested regularly, do you feel that? Oh wait, that's the second question. Sorry. Oh no, I lied. If I'm sorry, I'm reading a chat. If people are being COVID tested regularly, do you feel this is the best practice of prevention for spread or lockdown? Referring to lockdowns.
I think the best prevention is the universal precautions that we take, the PPE, the mask, the gloves, the hygiene. That is in my opinion, is the pivotal point, because laxity in that is where we will fail, honestly. The virus can't get to us if we have taken the necessary precautions. And in large regard, I think maybe a false sense of security of getting a vaccine. My concern is that people would then become lax in their, universal precautions. So, I think that's where it really stands. I think in terms of lockdown, well, I've certainly seen situations in large groups where universal precautions were not adhered to grossly, and then others where they were. And I can tell you that there was a dramatic difference in terms of COVID-19 spreading within those two different parties. So I would say for lockdown, it is an extreme measure. It has much more than a clinical purpose, but its impact economically and socially is we've already seen it. It's taken a huge toll. I would really strongly encourage trying to keep things open, but look, DC put in effect, but hasn't really enforced. That it's $1,000 fine if you're without a mask. And I've certainly seen a few who haven't had masks out still.
Mm-hmm.
So it only takes one, right? And I think collectively, I think our attitudes have changed significantly that we understand it. It's just a matter of sometimes we will get sloppy or lazy, or just fed up, So
Yeah.
I would encourage, really the first line really is what you do for universal precaution. And when I say universal precautions, those are the things where we talk about hand washing or face mask and all of those things that we have ad nauseum. Everybody has been told time and time again.
Okay. What about, you had mentioned that for the COVID vaccine, you would not get it the first round. However, you are practicing staying, safe, staying away from people, quarantining. But would the vaccine help you to not spread COVID to others, or will you still be considered a spreader if you got COVID even after?
You can still get the virus and you can still spread it.
Okay.
My point is to become ridiculously OCD about, well, first of all, the testing, as much, I've tested over 2,800 people. All right. So, I've certainly had a lot of positives, and, it kind of, not to pat myself on the back, but it kind of says, hey, you're kind of doing it right if you haven't gotten it already. Right. So that is only proof to me that, if I keep up the same practice, I don't get sloppy, and I test myself. Look, if I test positive at any point, I'm out. I'm out for the period of time that I'm quarantined. And, the vaccine will not give you it's not a shield. It is not a barrier. It is simply boosting your immune system. You will still be able to spread it and you have to think for COVID-19 that we have a lot of asymptomatics, although they are less capable of spreading, and when we say asymptomatic, let's be clear, invariably, when we do contact tracing, when people say they don't have symptoms, they actually do. They're minor symptoms, but a minor symptom is not asymptomatic. There's some, and sometimes people will not really fully appreciate that, 3 days ago, I was feeling kind of, cruddy. But that means that's not asymptomatic. That means you are symptomatic. And I think, people need, every day is a struggle. You wake up on the wrong side of the bed in the morning. But I would say that just being vigilant with this will help us to get through this.
Okay. Is there, do you see that the COVID vaccine might be a required vaccine in the future, like mumps or measles?
I do think, well, in terms of requirement, influenza itself is not required. Mm-hmm. And when we talk about other vaccinations in terms of the requirement, they're required under certain circumstances. For schools, they're required for, entry into certain medical facilities, those sorts of things. And then there are options for people for religious purposes to be able to say, well, I'm not going to get this. So I think that needs to be a public discussion, and I think people have rights, patients have rights. I think it's just, I want to know that people understand that the vaccine is only one part of the pieces that will help us get through this.
Last question, unless anybody else has any, just type it into the bar. Last question I have right now is there any argument to make for herd immunity coming through more infections?
Yeah, so herd immunity is based on the theory of kind of like a wildfire. Look, we've done a lot of development, and, people would say in terms of the national parks, we've protected a lot of the forestry. But if you look historically, 34 million acres of forest would burn in a year back before the National Forest Service. So it would beg the question, are we going against nature? I think that's a tricky question. I think herd immunity is, I don't think we should throw up our hands. I think if we're talking about herd immunity, it's kind of, if we were to look at something like chickenpox. In the UK, if one child started to get that rash, guess what? All the parents would herd all the kids together and they'd all get it at the same time. That makes sense for that virus, maybe, but that's the British way of doing things. Can be quite miserable, but the vaccine has worked, phenomenally. I think for COVID-19, we are talking about another virus that's dramatically different. And it's a question of herd immunity, whether, why don't we have herd immunity for influenza? Well, the nature of the virus is it mutates, it changes so dramatically. We can't do herd immunity for influenza, so it doesn't quite make sense for herd immunity for COVID-19. I think the fire will burn, there's no question. It's just a question of what measures we can take that are preventative, and that and again, the front line is, what are you doing for universal precautions?
Okay.
Now it's a question, a universal precaution means, well, do we have to live the rest of our lives in a bubble? I don't know the answer for that. I think what may happen is this fire may burn itself out. Very often there will be viral strains that come and go. We don't hear anything more about MERS or SARS, right? So where are they? Well, we're hoping COVID-19 will kind of go the way of a less virulent, less dangerous virus. It's the novelty of COVID-19 is what makes it concerning, is how potent it is, and the death rate and fatality rate and morbidity.
I have a few more questions if you have some time. Will there be changes in how and where the flu vaccine is given because of COVID?
Really, there shouldn't be. There was some concern initially about the quantity of supply, but I think manufacturing has satisfied that. It should be readily available. Most pharmacies now, both for the regular and for the high dose. So if there is any concern that it is not accessible, that needs to be brought to the attention of state departments of health quickly. But as of right now, all of my patients are vaccinated, and I haven't had any issues.
What about at-home test for COVID? I don't know that there is one for flu, but are they effective at-home tests?
So the home testing, it is a question of several things. So when testing, the features are the quality of the sample, the preservation of the sample, the test itself, and the reliability of the testing. And if any of those are deficient, then the quality of the testing is going to dramatically be reduced. There is testing that can be done in the home. We do the testing same day for the long PCR. It is a quality sample. It is hand delivered to the private laboratory, and it is reported the same day. It's a question of what will be done with these kits. They're talking about in El Paso, sending out in drones these at-home kits for people to test themselves. When you do testing needs to be with a great deal of control. Otherwise, you can get a lot of data that just simply is not valid. It wouldn't hold up. And that's, my background in virology, immunology, and biochemistry is I'm a nut or OCD about the quality of testing and where there can be pitfalls. So, and again, what's the purpose for the testing? The testing is, again, another tool, but my question would be, well, what's the reason for taking tests, whether there are any symptoms or positive contacts? For people to test and then go back and not do universal precautions, to me, is an insult. You don't get tested and then not follow universal precautions. If anything, I would hope that the testing would reinforce the need for universal precautions. So I'll get off my high horse, but and believe me, I'm getting dermatitis from how many times I have to wash hands and put on gloves and lotion and everything.
I think it's a good soapbox to be on.
Yeah.
I think that answer may have answered this next question about the home test. Why will an individual need a doctor's prescription for the test?
Yeah. Yeah, I would have to agree that at some point it's got to, well, it's a matter of, it's the same thing. Why do you go to a laboratory to get the samples for blood or anything like that? You know, nobody can take their own blood and drop it off to the lab, right? It's a matter of control of the sample, and getting an order from a physician. If the physician needs, you know, your doctor needs to know what's going on. If you were to take testing somewhere and it's not reported to your regular physician, then your physician's kind of cut off at the legs and has no idea that, well, you know, maybe you need a little bit more assistance with universal precautions education or a variety of different things. But I think having a physician, a good primary physician who is there to be along this journey with you is extremely important. But that's, you know, that's a larger healthcare issue. You know, primary care has been cut off at the knees, and, you know, because of insurance companies, and I don't want to go in that conversation right now. But it's the reason why I don't have any choice but to do what I do in the way that I do it, because I want to practice medicine and I don't want to practice healthcare. That's a longer discussion.
Okay, we got time for 2 more questions. So here's our last 2. Who should have antibody tests?
So anybody who is tested positive for COVID-19 should absolutely have it, but you should not have antibody testing. I would really say 6 weeks. If you do it before 4 weeks, you may not have the right type of antibody for which they most commonly test, which is IgG. IgG is the antibody that we use when making vaccines. That's the antibody we want. Okay, that's the one that's going to fight. It's a strong antibody. There are others, IgM, which is an early antibody, but it doesn't really bring enough relevance to the picture. With regards to those who think they may anecdotally have had COVID-19, it would be a question of, again, what's the reason for doing the testing? You're doing the testing for reassurance that you have had COVID-19. Well, all right, you already have reassurance that you didn't get hospitalized and you didn't go to the ICU. What are you going to do with that? What are you going to do with the fact that you have antibodies? And again, it's the same thing as it is for the vaccine. How are we to say, we don't have the data yet to say that what antibodies you've produced will protect you from all future, just like if, you know, every time you get the influenza infection, you develop antibodies. But next season, influenza comes, you can get reinfected again. I think this is very much where COVID-19 is going to have the same replay. That if you are looking for that one thing that allows you to, puts up a shield, and, you know, it just doesn't exist.
And then the last question is, where is the best place that we should look for information as the COVID numbers change? Where's the accurate place to go?
Johns Hopkins, there is a link to the Johns Hopkins site, which is the map that most people are using now. In terms of information or updates in terms of clinical trial studies, vaccines, and those sorts of things, you know, it is very important that I try to go straight to the articles and the research, because that's my background, as opposed to news media, because there's just too much variation, you know, in the information. You know, one thing it's this, one thing is that. I just want to know. I want to dig into the data, and I really want to be able to say, okay, this. I can walk away and say, I have this understanding, and this is how this is what I'm going to do with that understanding. You know, there's just so much data and there's so much unknown. And I would say that's the most important part. There's still, even though we've been in this for so long now, there's still a lot. We have not completed a full cycle yet. And I think we will, certainly what will be most interesting will be the vaccine trials, and then development of the vaccine and its use for compassionate use, and see where does that change the curves. And that's the one thing I'm going to be looking at closest over the next 2 to 3 months. Because again, looking at not just what's being done here in the US, but the vaccine that's been developed in China, which is, now there are those in the Middle East who are actually getting the vaccine now. And they have had a lot more time and honestly, a lot more experience, particularly with SARS, to get the vaccine development up and right.
All right. I think that kind of concludes things here. I want to say, Dr. Brown, I don't know, can you hear the applause? Because,
No.
giving you a round of applause. That was really
That's the cut. That's the pull off this
virtual applause. Exactly. No. We'd like you to stay for even longer. Really appreciate you being here. I appreciate everybody who joined us today, taking the time out of their day to come and join this. I hope you found it as informative and useful as we did. Dr. Brown, I really appreciate your dedication to your patients and their families. They're very lucky to have you as their primary doctor. We're sending you a lot of energy and our best.
Thank you.
Spirits up. We really appreciate those efforts. I think last thing I'll say is the takeaway. One of the biggest things you said to me today was prevention are the practices that you take. That's doing those universal precautions, getting your flu shots, washing your hands, wearing your mask. And my hope is that everybody does that and we can power through this. So thanks again to everybody.
Absolutely. Thanks so much.
Okay. Bye now.